Explain the components and importance of a comprehensive medical history. How does each element contribute to diagnostic reasoning? Answer: a comprehensive medical history includes the following components. History of present illness (HPA) provides detailed information about the patient's current condition, including the onset, duration, and characteristics of symptoms. This helps in forming a differential diagnosis. Past medical history includes previous illnesses, surgeries, and treatments. Understanding the patient's past helps to identify risk factors for current conditions. Family history provides insight into genetic predispositions and hereditary conditions. Family history can guide screening and preventive measures. Social history includes lifestyle factors such as smoking, alcohol use, occupation, and living conditions. This context is crucial for understanding health risks and compliance issues. Review of systems: a systematic approach to uncover any additional symptoms that may not have been initially reported. Each element contributes to a holistic understanding of the patient's health, guiding diagnostic reasoning and clinical decision-making. For example, a young patient presenting with chest pain may have a family history of cardiac disease, prompting a more aggressive investigation for cardiac causes. How do you develop a differential diagnosis based on patient presentation? Discuss the role of diagnostic tests in refining this process. Answer: developing a differential diagnosis involves several steps. Gathering information. Use comprehensive history-taking and focused physical examination to identify key symptoms and signs. Formulating hypotheses. Based on the initial information, create a list of potential diagnoses that could explain the patient's presentation. Consider common conditions first, e.g., myocardial infarction for chest pain, using diagnostic tests. Diagnostic tests, laboratory tests, imaging play a crucial role in refining the differential diagnosis. For example, blood tests. Elevated troponin levels may indicate myocardial infarction, confirming a leading hypothesis. Imaging. A chest X-ray may rule out pneumonia or pleural effusion in a patient with respiratory symptoms. Critical evaluation of clinical data. Assess the results of diagnostic tests in conjunction with clinical findings to narrow down the differential diagnosis. This iterative process is essential for accurate diagnosis and treatment planning. Discuss the key considerations and techniques involved in inserting an IV cannula. What potential complications should be monitored? Answer: key considerations for IV cannula insertion include indication for insertion, identify the need for IV access, e.g., hydration, medication administration, site selection, choose an appropriate vein, typically in the forearm or hand. Ensure the site is free of infection and avoid areas of joint flexion. Aseptic technique. Maintain strict aseptic technique to minimize infection risk. This includes hand hygiene using sterile gloves and disinfecting the insertion site. Insertion technique use. A suitable gauge cannula for the intended purpose, e.g., larger gauge for rapid fluid administration. Insert the cannula at a 1530-degree angle with the bevel up and advance until a flashback of blood is seen. Secure the cannula and apply a sterile dressing. Monitoring for complications. Post-insertion, monitor for potential complications such as phlebitis, inflammation of the vein, which may cause redness, swelling, or pain. Infiltration. Leakage of fluid into the surrounding tissue, causing swelling, infection, localized or systemic infection indicated by redness, warmth, and fever. Regular assessment of the IV site is essential to identify and manage complications promptly. Describe the principles of safe prescribing. How does medication reconciliation contribute to patient safety? Answer: safe prescribing principles include correct dosage. Calculate the appropriate dose based on patient-specific factors, age, weight, renal function, contraindications, and side effects. Assess the patient's medical history and current medications to identify potential contraindications and drug interactions. Patient education. Inform patients about their medications, including indications, expected side effects, and the importance of adherence. Monitoring. Regularly review the patient's response to therapy and adjust treatment as necessary. The medication reconciliation is the process of ensuring accurate and complete medication information during transitions of care. It involves comparing the patient's current medication list with newly prescribed medications to identify discrepancies, ensuring continuity of care by preventing medication errors such as omissions, duplications, or incorrect dosing. Mr. Thompson is a 75-year-old patient with advanced lung cancer. He expresses a desire to stop aggressive treatment and enter hospice care. However, his family insists that he continue treatment in hopes of a cure. What ethical principles should guide your decision-making in this scenario, and how would you communicate with Mr. Thompson and his family? Answer: in this scenario, several ethical principles must be considered. Autonomy. Mr. Thompson has the right to make decisions about his own care. Respecting his wishes for hospice care aligns with the principle of autonomy. Beneficence and non-maleficence. While the intent is to benefit the patient by providing treatment, continuing aggressive interventions may cause more harm and suffering, conflicting with the principle of non-maleficence. Justice. Consider fairness in resource allocation, ensuring that healthcare resources are used effectively and ethically. Communication strategies. Engage in open dialogue. Facilitate a meeting with Mr. Thompson and his family, listen to their concerns and provide a space for them to express their emotions and perspectives. Educate on options. Clearly explain the benefits and limitations of continued treatment versus hospice care, using evidence-based information to illustrate the likely outcomes, support decision-making, help the family understand the importance of respecting Mr. Thompson's wishes while addressing their emotional needs, encourage discussions about end-of-life care that aligns with his values and preferences. What are the key components of documents in clinical findings, and why is accurate documentation crucial in patient care? Answer: key components of documenting clinical findings include patient identification, include the patient's name, date of birth, and unique identifiers to avoid confusion, date and time. Record the date and time of the examination or procedure. Subjective data. Capture the patient's reported symptoms and concerns in their own words, often included in the HPI. Objective data. Document findings from the physical examination, including vital signs, system examinations, and any diagnostic tests performed. Assessment. Summarize clinical reasoning, including differential diagnosis considered based on the findings. Plan. Outline the proposed management plan, including further investigations, treatment options, and follow-up arrangements. Importance of accurate documentation. Continuity of care. Provides essential information for healthcare providers involved in the patient's care, facilitating informed decision-making. Legal protection. Serves as a legal record of the care provided, protecting against potential claims of negligence. Quality assurance. Supports the evaluation of care quality and outcomes, allowing for improvements in practice based on documented results. Accurate documentation is integral to effective patient management and safety. Discuss how to interpret lab results, particularly focusing on blood tests and urinalysis. What steps should be taken to ensure accurate interpretation? Answer: interpreting lab results requires a systematic approach. Understand reference ranges. Familiarize yourself with normal ranges for various tests, as these can vary based on the population studied and laboratory standards. Clinical context. Always interpret lab results in conjunction with the patient's clinical presentation. For instance, elevated liver enzymes alt-astin. A patient with jaundice may indicate hepatocellular injury. Identify trends. Look for changes in results over time rather than relying on single values. For example, a rising creatinine level may suggest worsening renal function. Cross-referencing tests. Use results from different tests to support or contradict findings. A positive urinalysis for glucose in a patient with high blood glucose levels suggests diabetes. Consult guidelines. Refer to clinical guidelines for interpreting specific test results, which may provide insight into the significance of findings. Accurate interpretation is critical for appropriate diagnosis and treatment decisions. What are the key elements of informed consent, and how can healthcare professionals ensure they adhere to these principles? Answer: key elements of informed consent include capacity. Ensure the patient has the mental capacity to understand the information and make a decision about their treatment. Disclosure. Provide comprehensive information about the proposed treatment, including risks, benefits, alternatives, and potential consequences of not proceeding. Understanding. Assess the patient's understanding of the information provided. This may involve asking them to explain the procedure in their own words. Voluntariness. Ensure that the patient is making a decision free of coercion or undue influence. Documentation. Record the consent process, including the information provided and the patient's expressed wishes. Adhering to principles. Use clear and accessible language, avoiding medical jargon. Allow time for questions and provide answers to ensure understanding. Regularly review consent, especially if circumstances change or new risks arise. What are the indications and contraindications for performing venipuncture? Discuss the technique and aftercare required to minimize complications. Answer: indications for venipuncture, blood sampling to obtain blood for diagnostic tests, CBC, biochemical tests, therapeutic procedures. To administer medications or fluids via IV access, contraindications for venipuncture, infection at the site, avoid areas with active infections to reduce the risk of spreading infection, thrombocytopenia. In patients with very low platelet counts, venipuncture can increase the risk of bleeding, severe burns or scarring. These can compromise the integrity of the vein and make access difficult. Technique, preparation. Gather equipment, needle, tourniquet, collection tubes, explain the procedure to the patient and obtain informed consent. Site selection. Choose a suitable vein, typically in the antecubital fossa, ensuring it's palpable and visible. Insertion. Apply a tourniquet. Clean the site with an antiseptic and insert the needle at a 1530 angle. Once blood flows, collect the required samples. Aftercare. Apply pressure. After removing the needle, apply pressure to prevent bleeding. Dressing. Cover the site with a sterile dressing. Monitor for complications. Watch for signs of complications such as hematoma, infection, or phlebitis. Advise the patient on how to care for the site at home and what symptoms to report. Describe the principles of antimicrobial stewardship and its relevance in the management of infections. What strategies can be employed to promote effective use of antibiotics? Answer. Antimicrobial stewardship involves a coordinated approach to optimizing the use of antimicrobials, aiming to improve patient outcomes while minimizing adverse effects and resistance. Principles. Appropriate selection. Use the most effective antimicrobial for the specific infection based on culture and sensitivity results whenever possible. Optimal dosing. Ensure the correct dose, route, and duration to maximize efficacy while minimizing toxicity and the risk of resistance. Monitoring. Regularly review and adjust therapy based on the patient's clinical response and laboratory results. Education. Promote understanding among healthcare providers and patients regarding the importance of appropriate antimicrobial use and the risks of overprescribing. Strategies for effective use. Implement guidelines. Use evidence-based guidelines for prescribing antibiotics for common infections. De-escalation. Transition from broad-spectrum to narrow-spectrum antibiotics as soon as culture results are available and patient status allows. Regular review. Conduct routine audits of antibiotic use and resistance patterns to identify areas for improvement. Infection control measures. Encourage practices such as hand hygiene and vaccinations to reduce infection rates and the need for antimicrobials. Antimicrobial stewardship is vital in combating resistance and ensuring effective treatment for infections. What are the key features of diabetes mellitus type 1 and how does it differ from type 2 diabetes? Answer. Key features of type 1 diabetes. Onset usually occurs in childhood or adolescence. Etiology. Autoimmune destruction of pancreatic beta cells leading to insulin deficiency. Symptoms. Classic symptoms include polyuria, polydipsia, weight loss, and fatigue. Management. Requires lifelong insulin therapy. Diet and exercise are also important. Differences from type 2 diabetes. Onset age. Type 2 typically develops in adults, often linked to obesity and lifestyle. Insulin resistance. In type 2, there is insulin resistance with a relative insulin deficiency, while type 1 involves absolute insulin deficiency. Management. Type 2 can often be managed with lifestyle changes and oral medications. Initially, insulin therapy may be required later. Describe the steps involved in conducting a focused history and physical examination in a patient with suspected asthma. Answer. Steps in history taking. Presenting complaint. Assess symptoms like wheezing, dyspnea, and cough. History of present illness. Explore onset, duration, frequency, and triggers of symptoms, e.g., allergens, exercise. Past medical history. Inquire about previous asthma diagnoses, hospitalizations, or respiratory infections. Family history. Check for a family history of asthma or allergic conditions. Medication history. Review current medications, including any use of bronchodilators or corticosteroids. Physical examination. General appearance. Assess for respiratory distress, e.g., use of accessory muscles. Auscultation. Listen for wheezing or reduced breath sounds on lung auscultation. Vital signs. Check oxygen saturation and respiratory rate. Clinical relevance. A focused history and physical examination guide diagnosis and management decisions in asthma. What are the characteristics of chronic obstructive pulmonary disease (COPD) and its common management strategies? Answer. Characteristics of COPD. Definition. A progressive lung disease characterized by airflow limitation due to chronic bronchitis and emphysema. Symptoms. Chronic cough, sputum production, and dyspnea, particularly during exertion. Risk factors. Smoking, occupational exposures, and environmental pollutants. Management strategies. Smoking cessation. The most important intervention for all patients. Medications. Bronchodilators. short-acting SUBAs and long-acting LOBAs to relieve symptoms, inhaled corticosteroids used in patients with frequent exacerbations, pulmonary rehabilitation, a structured program including exercise and education, oxygen therapy for patients with severe hypoxemia, clinical relevance. Management focuses on symptom control, improving quality of life, and preventing exacerbations. Explain the role of vaccinations in public health and identify key vaccines recommended for adults. Answer: Role of vaccinations. Disease prevention. Vaccines prevent the spread of infectious diseases and reduce morbidity and mortality. Herd immunity. High vaccination rates within a community protect those who are unable to be vaccinated. Cost-effective vaccination programs can reduce healthcare costs associated with treating vaccine-preventable diseases. Key vaccines for adults. Influenza vaccine, recommended annually for all adults. Tetanus, diphtheria, and pertussis Tdap, booster every 10 years. Shingles vaccine, recommended for adults over 50. Pneumococcal vaccine, recommended for adults over 65 or those with risk factors. The COVID-19 vaccine, recommended as per current guidelines and booster recommendations. Clinical relevance. Healthcare providers should promote vaccination as an integral part of preventive healthcare. Describe the mechanisms and clinical implications of antibiotic resistance. Answer: Mechanisms of antibiotic resistance. Genetic mutations. Bacteria can mutate to develop resistance. Horizontal gene transfer. Bacteria can acquire resistance genes from other bacteria through plasmids. Selective pressure. Overuse and misuse of antibiotics promote the survival of resistant strains. Clinical implications. Treatment failure. Increased difficulty in treating infections, leading to higher morbidity and mortality. Longer hospital stays. Patients with resistant infections may require more extensive treatment. Public health concern. Outbreaks of resistant strains can lead to public health crises. Clinical relevance. Understanding antibiotic resistance is crucial for effective prescribing practices and infection control measures. What is the importance of patient education in managing chronic diseases? Answer: Importance of patient education. Empowerment. Educating patients enables them to take an active role in their health management. Adherence. Improved understanding of their condition leads to better adherence to treatment plans. Self-management. Patients gain skills to manage their symptoms, recognize exacerbations, and know when to seek help. Prevention of complications. Knowledge about lifestyle modifications and disease management can prevent disease progression and complications. Clinical relevance. Effective patient education is vital in chronic disease management and contributes to improved health outcomes. What are the signs and symptoms of anaphylaxis and how should it be managed in an emergency setting? Answer: Signs and symptoms of anaphylaxis. Rapid onset. Symptoms occur within minutes of exposure to the allergen. Respiratory symptoms: wheezing, difficulty breathing, throat swelling or stridor. Cardiovascular symptoms: rapid pulse, hypotension or loss of consciousness. Gastrointestinal symptoms: nausea, vomiting, abdominal pain or diarrhea. Skin reactions: hives, flushing or swelling. Management in emergency setting. Administer epinephrine intramuscular injection, usually the outer thigh, is the first-line treatment. Call emergency services. Immediate medical assistance is crucial. Positioning. Lay the patient flat with their legs elevated unless breathing is compromised. Administer oxygen. Provide supplemental oxygen if needed. Monitor vital signs. Continuously monitor heart rate, blood pressure and oxygen saturation. Antihistamines and corticosteroids considered for further management, but epinephrine is the priority. Discuss the role of palliative care in managing patients with terminal illnesses. Answer: Role of palliative care. Holistic approach. Palliative care focuses on improving the quality of life for patients with serious life-limiting illnesses, addressing physical, emotional, social, and spiritual needs. Symptom management. Effective management of symptoms such as pain, nausea, and fatigue is central to palliative care. Interdisciplinary team. Involves a team of healthcare professionals, including doctors, nurses, social workers, and chaplains. Family support. Provides support for families coping with the challenges of terminal illness and bereavement. Communication. Encourages open discussions about goals of care and advanced directives. Clinical relevance. Palliative care should be integrated early in the disease process alongside curative treatment when appropriate to enhance patient and family well-being. Discuss the significance of the Glasgow Coma Scale (GCS) in assessing patients with head injuries. Answer: the Glasgow Coma Scale (GCS) is a critical tool in the assessment of patients with head injuries, providing a systematic method for evaluating consciousness levels. Developed in 1974, the GCS assigns scores based on three components: eye-opening 1, 4 points, verbal response 1, 5 points, and motor response 1, 6 points. The total score ranges from 3 to 15, with lower scores indicating more severe impairment. Significance. Severity classification. The GCS helps classify head injury severity into mild GCS 1-3, 1-5, moderate GCS 9, 1-2, and severe G equals it. This classification is crucial for determining the urgency and type of medical intervention required. For instance, a patient with a GCS of 8 or less often necessitates immediate intubation and intensive monitoring. Monitoring changes. The GCS serves as a baseline for monitoring a patient's neurological status over time. Regular reassessment can reveal deterioration or improvement, guiding treatment decisions and interventions. Prognostic value. Research indicates that GCS scores are predictive of patient outcomes. A low initial GCS is associated with a higher risk of mortality and long-term disabilities. Understanding these prognostic implications can aid healthcare providers in counseling families and planning rehabilitation. Communication tool. The GCS facilitates communication among healthcare professionals. Using a standardized scale enhances clarity when discussing a patient's condition with colleagues or during handoffs. In summary, the Glasgow Coma Scale is a vital instrument in trauma and emergency medicine, aiding in the assessment, monitoring, and prognostication of patients with head injuries. What are the common side effects of antihypertensive medications? Antihypertensive medications are crucial for managing high blood pressure and reducing the risk of cardiovascular events. However, they can have side effects that impact patient compliance and overall treatment effectiveness. Understanding these side effects is essential for healthcare providers to anticipate and manage complications. ACE inhibitors, e.g. lisinopril. Common side effects. A persistent dry cough occurs in about 1.0–2% of patients, often leading to discontinuation of the drug. Hyperkalemia, elevated potassium levels can occur, especially in patients with renal impairment. In rare cases, angioedema, swelling of deeper layers of the skin, may develop, posing a severe risk. Angiotensin receptor blockers, ARBs, G. losartan. Common side effects. While generally better tolerated than ACE inhibitors, ARBs can still cause dizziness, hyperkalemia, and hypotension. They have a lower incidence of cough compared to ACE inhibitors. Calcium channel blockers, e.g. amlodipine. Common side effects. Peripheral edema. Swelling in the lower extremities is a significant issue, often due to vasodilation effects. Other side effects include headaches and constipation, particularly with non-dihydropyridine calcium channel blockers. Beta blockers, e.g. metoprolol. Common side effects. Fatigue and exercise intolerance are common, as beta blockers can blunt the sympathetic nervous system response. Bradycardia, slow heart rate, and cold extremities can also occur, particularly in patients with pre-existing heart conditions. Diuretics, e.g. hydrochlorothiazide. Common side effects. Electrolyte imbalances, particularly hypokalemia, low potassium levels, are common due to increased urine production. Other side effects may include dehydration and increased urination, which can affect daily activities. Alpha blockers, e.g. doxazosin. Common side effects. Orthostatic hypotension, particularly with the first dose, can lead to dizziness and falls. Patients may also experience nasal congestion and headache. Awareness and management of these side effects are crucial for maintaining adherence to antihypertensive therapy and ensuring optimal patient outcomes. Discuss the role of the gut microbiome in health and disease. How might alterations in the microbiome contribute to conditions such as inflammatory bowel disease and obesity? Answer: the gut microbiome comprises trillions of microorganisms that play a critical role in maintaining health. Key functions include nutrient absorption. The microbiome aids in digesting complex carbohydrates and synthesizing vitamins, e.g. vitamin K, B vitamins. Immune modulation. It influences the immune system, helping to prevent infections and reducing inflammation. Alterations in the gut microbiome. Dysbiosis can contribute to various conditions. Inflammatory bowel disease, id. Dysbiosis is associated with reduced microbial diversity and an imbalance between pro-inflammatory and anti-inflammatory bacteria, exacerbating intestinal inflammation. Obesity. Studies suggest that certain gut bacteria may influence energy extraction from food and fat storage. For example, an increased ratio of firmicutes to bacteroidetes has been observed in obese individuals. What are the key features of hypothyroidism and how do they differ from hypothyroidism? Discuss the implications for treatment. Answer: hypothyroidism is characterized by excessive production of thyroid hormones, while hypothyroidism involves insufficient hormone production. Key features include hypothyroidism symptoms: weight loss despite increased appetite, heat intolerance and excessive sweating, palpitations and increased heart rate, anxiety and tremors, increased frequency of bowel movements. Hypothyroidism symptoms: weight gain despite decreased appetite, cold intolerance and decreased sweating, bradycardia, slower heart rate, depression and fatigue, constipation. Management: hypothyroidism. Treatments may include antithyroid medications, e.g., methimazole, radioactive iodine therapy, or thyroidectomy, depending on the cause, e.g., Graves' disease, toxic nodular goiter. Hypothyroidism, managed with synthetic thyroid hormone replacement, levothyroxine, requiring regular monitoring of thyroid function tests to maintain appropriate hormone levels. The differing clinical features and underlying pathophysiology necessitate tailored approaches in management strategies, emphasizing the importance of ongoing monitoring. Outline the pathophysiology, clinical features, and management strategies for chronic obstructive pulmonary disease (COPD) exacerbations. Answer: COPD exacerbations are acute events characterized by worsening respiratory symptoms. The pathophysiology involves airway inflammation. Increased inflammatory mediators lead to airway obstruction and mucus hypersecretion. Bronchospasm. Smooth muscle contraction contributes to airflow limitation. Clinical features: increased dyspnea, increased sputum production, purulent, cough worsening, increased respiratory rate and heart rate, possible hypoxemia. Management strategies: oxygen therapy, administer supplemental oxygen to maintain target SPO levels 88-92%. Bronchodilators, use short-acting beta-agonists, SOBAs and anticholinergics for bronchodilation. Corticosteroids, systemic corticosteroids, e.g., prednisone for anti-inflammatory effects. Antibiotics, if bacterial infection is suspected, e.g., increased purulent sputum, initiate appropriate antibiotics. Non-invasive ventilation, NIV, consider in cases of respiratory failure. The GOLD guidelines provide a framework for the management of COPD exacerbations, emphasizing early intervention and tailored treatment plans. What are the differences between primary and secondary hypertension, and what are the potential causes of secondary hypertension? Answer: primary hypertension, essential hypertension, is characterized by high blood pressure without an identifiable cause, accounting for about 90.95% of cases. It often results from a combination of genetic, environmental, and lifestyle factors. Secondary hypertension, on the other hand, results from identifiable underlying conditions. Potential causes include chronic kidney disease, impaired renal function leading to fluid retention and increased blood pressure, endocrine disorders. Conditions such as hyperaldosteronism, pheochromocytoma, or Cushing's syndrome can cause secondary hypertension. Medications: certain drugs, e.g., NSAIDs, oral contraceptives, corticosteroids, can elevate blood pressure. Obstructive sleep apnea, intermittent hypoxia, and increased sympathetic tone can lead to elevated blood pressure. Coarctation of the aorta, a congenital condition causing elevated blood pressure in the upper body and low blood pressure in the legs. Discuss the significance of early recognition and management of sepsis. What are the key components of the Surviving Sepsis Campaign guidelines? Answer: early recognition and management of sepsis are critical to improving patient outcomes, as the condition can progress rapidly to septic shock and multi-organ failure. Key components of the Surviving Sepsis Campaign guidelines include early identification, use of screening tools to recognize patients at risk for sepsis, e.g., SIRS criteria, sepsis bundle, implementing the sepsis bundle within the first hour of recognition, which includes blood cultures. Obtain cultures prior to starting antibiotics to identify the causative organism. Antibiotics. Administer broad-spectrum intravenous antibiotics as soon as possible, ideally within the first hour. Fluid resuscitation. Administer IV fluids, 30 Ag crystalloid, to restore hemodynamic stability. Vasopressors. Use vasopressors, e.g., norepinephrine, if hypotension persists despite fluid resuscitation. Explain the concept of antibiotic stewardship and its importance in clinical practice. What strategies can be implemented to promote responsible antibiotic use? Answer: antibiotic stewardship refers to coordinated efforts to improve and measure the appropriate use of antibiotics, aiming to optimize patient outcomes while minimizing adverse effects and the development of antibiotic resistance. Importance in clinical practice includes reducing resistance. limiting the spread of antibiotic-resistant bacteria through judicious use of antibiotics, improving patient outcomes, enhancing treatment efficacy while minimizing adverse drug reactions and healthcare costs. Strategies to promote responsible antibiotic use include guideline development, establishing evidence-based guidelines for the treatment of infections, specifying indications for antibiotic use, education and training, providing ongoing education for healthcare professionals about the appropriate use of antibiotics and resistance mechanisms, audit and feedback, implementing regular audits of antibiotic prescribing practices and providing feedback to prescribers. What are the common types of strokes and how do their pathophysiology and management strategies differ? Answer. Strokes can be broadly classified into two main types: ischemic and hemorrhagic. Ischemic stroke, caused by the occlusion of cerebral blood vessels, accounting for approximately 87% of all strokes. Common causes include embolism from cardiac sources and thrombosis due to atherosclerosis. Management: acute treatment, administration of tissue plasminogen activator (EPA) within 4.5 hours of symptom onset if no contraindications exist, endovascular therapy, mechanical thrombectomy for patients with large vessel occlusions, secondary prevention, antiplatelet agents e.g. aspirin, clopidogrel, and management of risk factors, hypertension, diabetes. Hemorrhagic stroke results from the rupture of a blood vessel leading to bleeding in or around the brain. Common causes include hypertension and aneurysms. Management: acute treatment. Focus on stabilizing the patient, controlling blood pressure, and surgical interventions e.g. clipping or coiling of aneurysms if necessary. Rehabilitation: extensive rehabilitation may be required to address neurological deficits. Understanding the differences in pathophysiology and management is crucial for optimal patient care and recovery outcomes. Describe the clinical features and management of acute pancreatitis. What are the common causes and how does the severity influence treatments? Answer. Acute pancreatitis is characterized by inflammation of the pancreas leading to abdominal pain and systemic complications. Clinical features: severe abdominal pain often radiating to the back, nausea and vomiting, fever and tachycardia, signs of dehydration. Common causes: gallstones, the most common cause, leading to obstruction of the pancreatic duct. Alcohol consumption: chronic alcohol use can trigger episodes of acute pancreatitis. Medications: certain drugs e.g. corticosteroids, diuretics may also contribute. Hyperlipidemia and hypercalcemia both can precipitate acute pancreatitis. Management: supportive care includes IV fluids, pain management, and electrolyte monitoring. Nutritional support: in mild cases, oral intake can be resumed as tolerated. In severe cases, enteral feeding may be indicated. Identify and treat underlying causes. Management of gallstones may require surgery. Cholecystectomy and alcohol cessation is critical. The severity of acute pancreatitis assessed using the Atlanta classification influences treatment decisions and the need for intensive monitoring or surgical interventions. What are the principles of palliative care, and how can they be integrated into the management of patients with terminal illnesses? Answer. Palliative care is a holistic approach aimed at improving the quality of life for patients with life-limiting illnesses through symptom management, psychosocial support, and spiritual care. Key principles: patient-centered care. Focus on the individual needs, preferences, and values of the patient and family. Symptom management. Effective treatment of pain, nausea, fatigue, and other distressing symptoms. Interdisciplinary approach. Collaboration among healthcare professionals, doctors, nurses, social workers, chaplains, to address physical, emotional, and spiritual needs. Advanced care planning. Encouraging discussions about goals of care and advanced directives to ensure alignment with the patient's wishes. Support for families. Providing emotional and practical support to family members during the patient's illness and bereavement. Integration of palliative care can begin at diagnosis and continues alongside curative treatment or as the focus shifts to end-of-life care, enhancing patient and family experiences. Explain the significance of genetic counseling in the management of hereditary cancers. What are the key components of a genetic counseling session? Answer. Genetic counseling plays a vital role in the management of hereditary cancers, helping patients understand their risk, the implications of genetic testing, and the options available for prevention and early detection. Significance: risk assessment, identifying individuals and families at risk for hereditary cancer syndromes, e.g. BRCA for breast and ovarian cancer. Informed decision-making, helping patients make informed choices about genetic testing and management strategies, e.g. increased surveillance, prophylactic surgery, family planning, providing information about the inheritance patterns and risks for relatives. Key components of a genetic counseling session: family history assessment, detailed evaluation of the patient's and family's medical history to identify potential hereditary patterns; education, explanation of genetic testing options, benefits, limitations, and potential outcomes; emotional support, addressing psychological aspects and concerns related to genetic risk in testing; management recommendations, discussing screening and risk reduction strategies based on test results. Genetic counseling is a critical component in the comprehensive care of patients with hereditary cancers, promoting early detection and personalized management strategies.